This survey took place as part of the Hospital Pharmacy Forum sponsored by Pfizer, and the purpose of it was to provide the pharmacists participating in the survey with some sort of context around what is the experience of communication in hospital medicines management, where there are inefficiencies and what we can do about it to solve it. Well, the three main themes to emerge from the survey is that communications inefficiency in hospital medicine management, they're common, they're costly, and they have widespread impact. That's the first theme. Second theme is that there's good examples of success stories of good communications in hospitals management, but it's not yet the norm. And the third and final theme, that in terms of priorities for action, we're looking at much better information technology, better focus on data and analytics, and also trying to build stronger communication between the pharmacy and nurses and doctors. There was a contrast in the survey findings between pharmacists generally felt that there was enough information in the system and there was the right type of information, but how it was communicated and when it was communicated was a problem. And in particular, the problem was lack of access to useful, up-to-date metrics. One of the areas where there's clearly most scope for improvement is around the area of metrics, because half of the pharmacy surveyed said they just don't have access to useful, up-to-date metrics. Yet all of the metrics we asked about were available in at least one pharmacy on a daily or more frequent basis. So there's clear scope to do this, and perhaps this is something that we can help with. We could achieve about 5 million of savings if we eliminated communications inefficiencies in medicines management. About 10% of pharmacy staff time is spent on dealing with the consequences of communications inefficiencies. 3/4 of an hour per day of a pharmacist's time, an hour and a quarter of pharmacy technician time is spent on dealing with these issues. And they are direct financial costs, but beyond that, and one thing we didn't capture in the survey, is the consequences to patient care, the length of time they spend in hospital, adverse drug events, which would have other significant economic impacts. What this survey has achieved is we've got a good picture of pharmacists' perception of the problem of communications inefficiencies in medicines management. The ideal next step will be go one step further and talk to the customers of the pharmacy, the doctors, the nurses, the patients, and find out their perceptions and their experiences of communications failures in medicines management to get a much more holistic view of what is actually happening. The barriers to change and the enablers of change were two sides of the one coin. Pharmacists identified poor and antiquated IT as a major barrier, along with the lack of a change culture within the hospitals within which they worked. In terms of the sort of solutions to those problems, they identified much better IT and engaging senior managers coupled with multidisciplinary teamwork.